I'm Joby Lagrange, reporting in Lafayette Parish, where I am at the Ochsner Lafayette General Breast Center. So can you tell me what is unique about this breast center particularly?
First off, I'm Shonda Grisby. I'm a breast surgical oncologist by trade. Been here since about 2017, and what we offer is a breast center that is comprehensive in regards to who works here. So you have fellowship-trained breast surgical oncologists along with fellowship-trained breast radiologists working together to treat, manage, and take care of patients that are dealing with breast diseases, whether it's benign or malignant, and so or cancer. So we work together in the same hallways. It allows us to be flexible, allows us to take care of patients in their whole entirety, and we have begun to grow what breast treatment and breast looks like across our region. And here we offer what we consider is a comprehensive approach to breast care.
Because it's already such an anxious time.
Mm-hmm.
So to know everything's in one place, everybody's working as a team, that sounds so supportive. And we touched on how you want this care to be able to be accessible everywhere.
Correct. And we both believe quality care is important and everybody should have access to it.
Can you tell me the genetic survey that people can take online to almost get the ball rolling on these processes?
Absolutely. We recognize that people are getting genetic testing either at their OB-GYN's office or primary care doctors are doing it, but they don't always understand their result. We've offered a couple things, which is growth of our genetic counseling team. We have an in-house genetic counselor that helps us patients understand their genetic results. And then we also have a high-risk clinic that offers care for people who are at high risk for breast cancer in general, or who may have a genetic mutation that we need to track and follow and make sure they get the appropriate follow-ups, whether that's MRIs of the breast or additional MRIs, or follow up with our gastroenterology team, for example. So they don't require a referral. They can go online and get what is called a genetic wellness assessment, and that will go through their history and let us know if they meet even a small smidget of criteria to have a conversation with our genetic counselor. And that genetic counselor will then reach out to them, and if they want to continue, we will get them scheduled to go through their family history in more detail and make sure that if they meet criteria for genetic testing, they get it. So the high-risk clinic allows us to do that. And so we offer that high-risk clinic here at our Ochsner Lafayette General Breast Center, and as well as our Ochsner University Hospital clinics.
Is there anything else that you would want women in the Acadiana area or surrounding areas to know?
Sure. I think the biggest thing people should know is, we know breast cancer is common. We know it's the most commonly diagnosed female breast cancer in the United States. I think about the fact that most people who are diagnosed are going to do well, 99% survival in 5 years, 10 years, because of how early we can catch it, right? So really, I think if anybody does anything, it's just the screening process and making sure they're up to date on it. And if there's any questions, I think that's really where centers like ours come into play to help answer those questions. How early should someone get this done? If I have family history, when should I start these things? And we're here to help answer those questions and help patients through that process.
So we talked about how the screening process, the treatment, and all these things very interconnected through this system. And you talked about everybody in multiple areas being able to have access.
Right.
Is there a special center that I hear is coming up with a special ribbon cutting?
Oh, yes. We actually opened up an infusion center in our Ochsner American Legion in Jennings. And the goal of that is just to get care close to home. It's a lot of treatments. People have to go back and forth, and we want patients to be able to get the care they need as close to home as possible.
Not just helping patients who walk in the door, but you want as many to be able to come through that door as possible. Really,
it's Breast Cancer Awareness Month, but breast cancer doesn't just happen in October, so we recommend you get your screening mammograms all year long. If you have a birthday coming up and turning 40, get your screening mammogram. If you know family history and you have some and you haven't gotten assessed, by all means, please reach out. We would be happy to assess your risk. But breast cancer happens any time of day. And so October is a great month to celebrate. We all love to wear pink, but it's definitely awareness all year long.